We'll be starting the session in just a moment. If you have any connection or technical issues, try refreshing your browser first. If this doesn't work, please go to the Help Desk by clicking Sessions on the left, or click the Attendee tab on the right and search Help Desk to send a private message. Thank you for joining us.
Welcome, everyone, to this year's Menus of Change Leadership Summit virtual edition. I am Jacqueline Shee, Director of Programs and Special Projects for the Strategic Initiatives Group at the Culinary Institute of America. On behalf of everyone at the college, thank you for joining us. While moving conferences and summits to the virtual space has not been without its challenges, we are so grateful that it has also afforded us the opportunity to expand our community of practitioners under this Menus of Change banner. And we are so excited to once again convene top scientists, industry experts, and chefs with you here in a kind of virtual auditorium as we collectively work towards advancing health and sustainability throughout the food service industry. This is thanks in no small part to the generosity of our program sponsors, whose support is helping us offer this year's summit to culinary professionals tuition-free. I hope you'll take some time over the next few days to meet them, especially during the networking times and in the Innovation Hub, and let them know how much we appreciate their contributions to this vital industry gathering. I'm going to do my part right now and say thank you to our platinum sponsor, Oatly, and our gold sponsor, Kellogg's Away From Home, as well as our bronze sponsors, Motif Foodworks, American Pecan Council, presented by the National Pecan Shellers Association, Nestle Professional, and North Harvest Bean Growers. And huge thanks to our supporting corporate and media sponsors. Another advantage of the virtual platform is that we have many ways for you to engage with us and one another. I'll be going over some of those features a little later on, but to get you warmed up, we'd love for you to let us know through the chat exactly where you're located right now so that we can bring our global reach to life. And we'd also love to get some insight into where your business is now with our first question active in our polls tab. And it looks like some people have already found that question. Did the pandemic and events in the past year instigate changes within your business as it relates to healthier menu items, climate-friendly menu items, sustainability goals, or labor models? We'll be checking in on those results and launching more questions later on, so please let us know your thoughts. Now, let's jump into the summit by welcoming Greg Drescher, Vice President of Strategic Initiatives and Industry Leadership at the Culinary Institute of America. Hi, Greg.
Hey, Jackie, how are you? I want to add my welcome to all of you who've joined this year's summit. 9 years ago, with our partners at the Harvard T.H. Chan School of Public Health, we set out to create a leadership initiative at the intersection of health and sustainability, culinary and business insight, and social responsibility. Over the years, Menus of Change has tapped into the best science, and we've learned from thought leaders and change makers in every sector of our industry. This work and that of others has contributed to a growing inseparability in industry conversations between personal and planetary health. Our Principles of healthy, sustainable menus and related resource development, such as the protein flip and our plant forward work, collectively have cast a bright light on not just what we need to do, but also the strategies we need to make change happen. Our Plant Forward Watch List series has highlighted the incredible innovation in our industry. This spring, we released our newest watch list with Foodservice Director, underscoring the movement towards plant forward in healthcare and senior living. Last year, we teamed up with Data Central to dig deeper into consumer attitudes around the shift from animal to plant proteins in the Plant Forward Opportunity Report. And this year, we have worked again with Data Central to probe a wider view of consumer beliefs and preferences that shape purchase intent. More on that in a bit. As we gather this year and at least start to think to put the pandemic behind us, you could easily make the case that it's enough just to think about restoring our operations, finding enough staff, and taking time to savor the renewed sense of community that so endears our industry to so many. And yet, we know that a host of critical and existential threats have not gone away during the pandemic, from climate change and water issues to the still accelerating global burden of diet-linked chronic disease. One positive in all this is the unprecedented level around the world of citizen, business, and governmental engagement with these issues. This fall, for the first time ever, the United Nations will host a Global Food Systems Summit. There's a very big lift ahead to reinvent our food systems, bring personal and planetary health to the center of our food choices, and make our industry more inclusive and equitable for all. But as we lean into these challenges, let's remember the enormous potential of entrepreneurial and market-based solutions and the power of chefs to reimagine deliciousness. It's now my pleasure to introduce the moderator of our first session, Michael Kaufman, who, in addition to being the chair of our Menus of Change Business Leadership Council, is a senior lecturer at the Harvard Business School and co-founder and partner at Positive Strategy, LLC. Michael, welcome.
Thanks so much, Greg, and it's a pleasure to join Jackie and Greg to welcome all of you to Menus of Change. The upside of our being virtual, as Jackie mentioned, is so many more of you can attend. The downside, of course, is we long to break bread together, so let's hope next year that will happen. This opening session is intended to both set a foundation of the state of the industry and then to cast our eyes forward to the future. How has the pandemic shaped our views about the very issues that Menus of Change examines deeply? Food, nutrition, and health, and our environment, and our collective challenge to move the needle on all fronts. So let's kick off our exploration by considering where our industry is today. And I hasten to add that even this is a challenge to summarize because there are major differences regionally and by industry segment within the US and certainly across the globe. I'll focus today on the US. So first slide, please. So the state of the industry in this overview, next slide, please. I'll take a look at 5 perspectives, briefly: operators, employees, consumers, supply chain, and shareholders. Next slide. From an operator point of view, next slide. The industry forecast for 2020 was that we would achieve together commercial and non-commercial sectors about $900 billion in sales. In fact, in 2020, we achieved about $240 billion less at $659 billion. Next slide. The forecast for 2021 is $731 billion, but as you'll see in a second, that actually may be a floor. It may go higher. Next slide. COVID-19 resulted in major shifts in the industry. What we saw in 2020 was a global decline in sales, a significant number of permanent restaurant closures, a shift in mix with limited service brands seeing much more rapid recovery, and a rapid growth of delivery aggregators, the Uber Eats and DoorDashes. The outlook for 2021 and beyond, there may still be some consumer reluctance around full service, but there is significant pent-up demand for that experience. And overall, the industry is expected to recover in most markets to 2019 levels by 2021. Next slide, please. The performance during the pandemic of winners and losers diverged really massively in terms of how they adopted and scaled a range of best practices. Most adapted their menu to simplify and just focus on their signature craveable items. The enhanced pickup and delivery and drive-through convenience for consumers, built digital customer relationships, and then became part of the solution, authentically supporting local communities and taking meaningful, proactive actions to support both employees and to protect their customers. Next slide, please. The restaurant sales recovery has been remarkable, especially in the last couple months. So here is a chart showing across 2014 to 2020 or 2019, a gradual build in seasonally adjusted monthly sales. And if you look at the far right, that's May, last month of 2021, which surpassed any of the prior months. Next slide, please. And here you see May 2021 at a $67.3 billion number, greater than February 2020, before the onset of the pandemic, of $66 billion. But one thing to keep in mind is that increase in sales is driven by about a 5% menu price increase. So traffic is down, but menu price has driven both the sales increase, menu price increase, and potentially some of the inflationary aspects that we're seeing. Next slide, please. In the public marketplace, restaurant stocks took a dive initially and then sharply recovered as both the GDP outlook improved and chains mobilized their COVID responses. Next slide, please. And the restaurant share of the food dollar, if you may recall, in the 1960s and 70s, it was at about 25%. It built slowly to exceed 50% in the last several years. And while one would have expected it declined during the pandemic, and it did, it's leveling out at about a 50-50 split. Next slide, please. From an employee point of view, next slide, please. We saw, of course, a massive loss of employment in April of 2020, and then a gradual recovery across the subsequent months, including this past May, where about 186,000 jobs were added to the restaurant industry. Next slide, please. But the employment overall is dampened across segments, and every segment has seen still and is still seeing dampened employment. Next slide, please. And the flip of that, though, is that for employees who are working, their average weekly hours has increased sharply. Next slide, please. But this is the sign that you've either seen or you posted. Next slide, please. And the headlines that we've all read and have experienced about the labor shortage squeezing especially full-service restaurants, getting folks both into the kitchen and into the dining room. Next slide, please. Danny Meyer, famous restaurateur, founder of Shake Shack, commented, "New York City restaurants are being crushed by the current labor shortage and may take months to get enough staff." Next slide, please. There is a question of whether it's really a shortage. Is this a movement of employees from our industry into other industries, the Amazons and Walmarts, who are paying wages perhaps that are higher than historic levels within our industry? Is this a question of unemployment benefits in some states still there? Is this a question of parents not being able to find childcare? I'm not sure that we're really going to be able to see this play out until the next few months. And then we'll see, in fact, if this is a permanent gap or a temporary one. Next slide, please. From a consumer perspective, next slide, please. On-premise dining demand is still high, was highest at a time when folks couldn't get it, and but still remains high at about 50% as of a couple weeks ago. Next slide, please. But consumers want to know what the brands they support are doing to address social and environmental issues. 70% of consumers say they want to know that. And in fact, in a NYU Stern Center study, products marketed as sustainable grew about 6 times faster than those that weren't. Next slide, please. Younger consumers are more willing to pay higher prices for environmental initiatives. 44% say they would do it even if it means raising prices a little, although 47% said they'd actually prefer for the companies to take on the cost without raising prices. Next slide, please. Americans overall support ESG objectives, but they're unfamiliar with the term. 3/4 care about a company's impact on the environment when making purchase decisions, and 68% say the same of efforts to promote diversity and inclusion, both in the workforce and customer base. Next slide, please. From a supply chain perspective, next slide. Food supply chains are stretched as Americans head back to restaurants. Shortages of ingredients and labor, and we've all seen now compounded by issues of cybersecurity. There's a quote from Mark Allen, who's the CEO of the International Foodservice Distributors Association, saying, over the last 6 weeks, and this is as of end of May, we've seen the market come roaring back faster than anyone could have anticipated. The startup has been, he said, in many ways as difficult as the shutdown. Next slide, please. From a shareholder and investor perspective, next slide. Larry Fink is the CEO of BlackRock, the world's largest asset manager with about $9 trillion of assets under management. In his 2021 letter to CEOs said the following: I believe that the pandemic has presented such an existential crisis, such a stark reminder of our fragility that has driven us to confront the global threat of climate change more forcefully and to consider how, like the pandemic, it will alter our lives. We know that climate risk is investment risk, but we also believe that climate transition presents a historic investment opportunity. Next slide, please. Next slide, please. What lies ahead? Next slide, please. The restaurant landscape certainly has fundamentally changed. Innovation, technology, changing consumer dynamics, menu variety will strike back, aggregators will flex their muscles. Their next-gen customer experience enabled by digital will be quite different. There'll be a rise of personalization, new places and spaces. In fact, the Restaurant Association is referring to points of access, not locations, given the onset of ghost kitchens. And on the right, you'll see missions and values at the fore. Brands are increasingly differentiating on purpose and values. Customers are more aware and more responsive to ESG, DEI, and societal impact. Next slide, please. So as we gather for the next 3 days across the globe, for each of us, the recovery is real, but the future will be different and is unwritten. As all of us, as leaders, if we have an opportunity to embrace challenge and implement the opportunity, but saying is not doing. So together we must understand and propel the business of healthy, sustainable, delicious food choice and create the positive impact we desire and require. So thank you. It is now my pleasure to introduce Walter Willett, the chair of Menus of Change Science and Technology Council and professor of epidemiology and nutrition at the Harvard Chan School of Public Health and professor of medicine at Harvard Medical School. For the last 4 decades, Walter has been the leading pioneer in nutrition research and long-term consequences of food choices. He is among the 3 most cited authors in all areas of science and has been recognized for his many extraordinary contributions with numerous awards for his research. The co-founder, along with Greg, of Menus of Change and a towering figure in all that we will study in these 3 days, please welcome Walter Willett. Walter?
Yes, thank you, Michael, for that introduction, and thank you everyone who is attending here. You are all really our partners in moving this agenda forward. And like Michael and others have said, I hope we'll be able to meet together in person next year. I'm going to give a quick overview on the health status as we look across America and a little bit across the world. Next, please. The big event, of course, in health during the past years was the pandemic. Here displayed, I think, in a nice way. We basically increased the number of deaths in the United States during 2020 by about 15%. And this has meant, as we've continued this on into the current year, that over 600,000 people have died due to the pandemic. But as I'll mention in a minute, this was not just simply a virus. Next slide, please. That, of course, the virus that causes COVID is the underlying cause, but in terms of mortality, other factors related to nutrition, obesity, diabetes, hypertension, heart disease, and low vitamin D levels have greatly contributed to the probability of dying once someone gets affected. There is still work underway to estimate the exact percentage or approximate percentage of added deaths here, but estimates are coming in somewhere between 25 and 50% of the deaths could have been potentially avoided if we had been in a good metabolic state in America. And of course, this applies to the rest of the world, where even though we're experiencing a dramatic downturn in new cases, the epidemic is still raging across many continents at this point in time. Next slide. the other underlying big factor here is the declining life expectancy in America. And this phenomena began well before the pandemic hit us. This is looking at the life expectancy trends over time in various countries around the world. If you look at men, for example, America is an exceptional country, and unfortunately in many not so good ways. 3 out of the 4 years before the pandemic, life expectancy decreased, and that trend is lagging behind other countries has been going on for a number of years. Now we are living about 6 years shorter than people in Japan, which has seen no decline in life expectancy and well below all the other economically developed countries. Next slide, please. A lot of this, like the deaths from the pandemic, have to do with obesity. These are looking at obesity trends, basically the percentage of people or the average BMI over time. And again, America is exceptional here. We're trending way above the other economically developed countries, as you can see at the top, both for men and for women. And Japan, again, very different, where in women, amazingly, the prevalence of obesity has not increased at all. It's still less than 5%. And that number in the United States is 42%. And this has a great deal to do with the declining life expectancy. The opioid epidemic has deservedly received quite a bit of attention, and we need to deal with that. But the longer term trend of increasing poor health is due mainly to, it appears, the obesity epidemic and its metabolic consequences. Next slide. Some of our colleagues at the Harvard School of Public Health have projected out the prevalence of obesity to 2030. This uses data from other maps you've seen establishing the trajectory, and it looks by 2030 that number for prevalence of obesity will not be 42%, it will be 52%, about 50% across the country. And you added another 30% that will be overweight and are overweight at this point in time. We're up at about 80% or perhaps even a little bit more by 2030, unless something really dramatic happens. There's some variation across the country. As you can see here, it's worse in the central part of the US and the South. But really, even in the Northeast, where rates are lower, we're just lagging about 10 years behind the worst part of the country in terms of obesity. Next slide. And the consequences are appearing. Heart disease rates have been coming down for about 60 years, but now in younger Americans and middle-aged Americans, heart disease rates are turning back up again. Next slide, please. Even though total cancers are coming down because of the decline in smoking, and the rates of smoking have come down dramatically, obesity-related cancers, and there are about a dozen of them, have started to turn around. And here, for example, colorectal cancer, which had been declining for many years in the more recent birth cohorts, the birth cohorts that became overweight and obese while they were still children, we're now seeing the consequences of that. And in younger Americans, colorectal cancer incidence and mortality is now climbing again. Next slide. Next, please. So the consequences of obesity are severe, and they will continue to play out because there's really about a 30 to 40-year lag between the prevalence of obesity and seeing the full consequences of that. Unfortunately, the impact of the COVID epidemic and the metabolic epidemic have not been evenly distributed across the population. This is looking at age-adjusted mortality or your hospitalization rates by race and ethnicity. And as you can see, the rates in non-Hispanic Blacks and Latino population and Native American populations are 4 to 5 times higher than the white population in the United States. Next slide, please. Much of this does have to do, again, the connection between underlying poor metabolic health, poor diets, and susceptibility to viral infections. This is looking at food insecurity during the pandemic. again, not spread evenly across populations within the United States. The rates of food insecurity in the United States among the Black population being about 3 times higher than among the white population. And food insecurity has major implications for food choices. Next slide, please. And the quality of the diet, the sum of the food choices has huge impacts, again, on the risk of obesity and diabetes. Here, for example, looking at weight change over time, potato chips, other types of potatoes, processed red meat, refined starches, all contributing to more weight gain over time, sugar-sweetened beverages at the top of the beverages, and nuts, whole grains, fruits, and vegetables having the opposite effect of being related to less weight gain over time. Next slide, please. So diet quality is critically important, and of course, that's what we're talking about at this conference. The other big event in nutrition during the past year was almost unnoticed, and that was the issuing of the dietary guidelines. No big surprise, these came out at the end of December, and January was not exactly a slow news month. And there were real problems with these guidelines. Next slide, please. They're 194 pages, and it's no big surprise that very few people have actually read them. When they first came out a few decades ago, it was 1 page for both sides. But now it's sort of overkill in terms of detail, and people just get lost looking at it. Unfortunately, in setting the recommended intakes, basically, the Scientific Advisory Committee had suggested that the Mediterranean diet, vegetarian diets, and a healthy version of the American diet could all be healthy. But in setting the recommended intakes, the USDA basically threw out the Mediterranean diet and the vegetarian diet and focused on an animal-centric American diet. So the light blue areas here are the recommended ranges, and the purple dots are the current intakes. And you can see for meats, poultry, and eggs, believe it or not, we're pretty much on target, and we're supposed to have about 5 times the intake of those foods compared to nuts, seeds, and soy products over on the right, when the actual evidence supports an opposite ratio. So the recommended intakes are really omitting the major conclusions of the Scientific Advisory Committee and almost turned upside down. Along with these, the recommendation was to double dairy consumption in the United States, which would have huge environmental impacts, and approximately double potato consumption, which a country facing an obesity epidemic just does not need. Next slide, please. So my advice about the dietary guidelines, if you haven't read them, don't bother. I should end with some good news. And that's probably the best progress overall has been made in the school food sector. There were new standards implemented by the Department of Agriculture, to their credit. They set the standards somewhere between 2010, 2014. And those set a really high standard for what would be available to kids in school. And so the diet quality on a score of 0 to 100 went from 57.9 in 2010 to 81.5 in 2014, 2015. A huge increase in just a short period of time, showing what's possible. Next slide. Next, please. Another bit of good news is that the work of the CIA and others here has been paying off. And this is from the Bloomberg News just a few weeks ago. And their headline was, "Is beef the new coal? Climate friendly eating is on the rise." And 70% of Americans, they described, would be healthier if the country ate less meat, and 58% would like to eat more fruits, vegetables, and nuts. So the word is getting out. Next slide, please. We have learned quite a bit from the COVID-19 pandemic. This is summarized on our website if you look for resources there. Very quickly, our poor dietary patterns have consequences. Late responses to major threats have a price. Epidemics and environmental changes follow laws of nature. They're not subject to manipulation just by policies. They will happen. Federal responses are critical, but state, local, and private sector leadership is invaluable. And we really saw that being very important in taking the lead often in dealing with the COVID-19 pandemic. Our food system needs greater resilience to absorb inevitable shocks. And very importantly, our world is interconnected. Public health and environmental challenges demand global responses. We are not an island anymore. Next slide, please. So just to summarize, the pandemic has had and is still having huge health and economic costs. A return to normal would be a bad outcome, as we have been on a path leading to disaster for human and planetary health. We do have the knowledge, creativity, and skills. A lot of them are in this meeting today, including culinary insight and inspiration that can create a future that is far healthier, more sustainable, and more just than we have today. This will take time, and that is all the more reason to redouble our efforts now. So I will now pass the baton over to my colleague and friend, Professor Jeffrey Sachs. Jeffrey Sachs was professor of economics at Harvard University, where I had the privilege of meeting Dr. Sachs and his wife, who, by the way, is a graduate of our School of Public Health. In contrast to many economists, Dr. Sachs realized that wealth is not just a question of dollars and cents, but that ultimately our Earth itself and its resources are very limiting resources and will determine our future as a human civilization. Essentially following this lead, Dr. Sachs left Harvard to move to Columbia University, where he became director of the Earth Institute. He stepped down from that position just a couple of years ago. He's now a university professor at Columbia and is still advisor to the Secretary General of the United Nations, as he was with Kofi Annan as well. So, Jeff, I won't take any more of your time. Please proceed.
And it looks like we are just getting Jeffrey up here. Thanks for that wonderful introduction, Walter. And Jeffrey, if you're able to hear us, if you can hit apply on your settings, I think we've got Jeffrey in a kind of a purgatory between his home and our stage here. So hopefully we can get him maybe while we're waiting for that. Walter, I know that you were working on that Eat Lancet report a few years ago, and it sounds like we've got a second edition coming. I was wondering if you could tell us a little bit about that.
Well, it's not guaranteed yet, but we're working on funding for the second version of our Eat Lancet report. Building on what we had before, I think anyone would want to know a couple of years from now what's the most current evidence. I think from everything we've seen, we were on target with our first edition, but there's some other dimensions. How do we make this more directly and more obviously applicable to different countries around the world that have different cultures, different food systems? We alluded to the need to do that, and we hope to do that more in the second version. Also, we, from the very beginning, decided that we shouldn't be constrained by cost, because if we did, we knew that many people right now can't afford a healthy diet, and we shouldn't say, well, because you can't afford a healthy diet, your criteria for a healthy diet would be different. No, that would be, I think, unfair and inconsistent with the United Nations goals. So we will try to bring in more of the economic perspective and how do we make healthy and sustainable diets affordable to everyone. Interestingly, the fact that many people can't afford a healthy, sustainable diet is not because of the sustainability, it's because of the health side. Many people are just eating mostly starch, very low fruits and vegetables, very limited dietary diversity. And clearly for health, we must improve those diets. So, Jeffrey, you're on the scene. Really good to see you.
How are you? I'm apparently on multiple cyberspace parallel universes, so I'm not sure where I am and whether I'm in duplicate, but I'm delighted to be here. Off and on trying to get into the room, I was able to hear most of the presentation. I'm not sure exactly how I can be most helpful, except to say that the problems that Walter explained of an America that is beset by an unhealthy diet are, of course, compounded in complexity by the fact that worldwide we have an ongoing, very deep, pervasive nutrition crisis. And on top of that, we have a crisis of the near production and sustainability of our food supply. And so of all of the issues that I grapple with in sustainable development, including climate change, including fighting poverty and so on, I think none is more complex than food sustainability, because we face a multi-dimensional set of challenges. A world population beset by malnutrition. Of course, around 1 billion people suffering from sheer and utter caloric and protein insufficiency. Another 2 billion suffering, roughly 2 billion suffering from micronutrient deficiencies. 1 billion suffering from obesity and numbers rising. And combined with the unsustainability of food production, where the land use changes attendant on food production, the chemical inputs, the energy inputs are the number one driver of anthropogenic change on the planet, whether it's the loss of biodiversity and habitat, the stresses on fresh water resources, or the greenhouse gas emissions, which are estimated to be between 25 and 30% of worldwide emissions resulting from agriculture, land use, and other land use changes. So this is a colossal mess. Walter is one of the gurus that is helping to lead us out of this mess. One of the crucial contributions that Walter Willett made with many colleagues around the world was showing that a more sustainably produced diet is consistent, indeed vital, to be joined with a more nutritious and healthful diet. So when one looks at a diet that could combat the obesity epidemic, it turns out to be a diet, of course, that is more based on legumes, plant-based proteins, fruits, vegetables that are also more sustainable in their production as well. I hope I'm doing okay, Walter. I've learned it all from you.
You're on target.
but the point is that very unusually among global problems, we have major multidimensional implications that cut across very, very different disciplines and concerns. One of the things I've learned in my policy experience is that the climatologists do not talk very much with the agronomists, who surprisingly don't talk very much necessarily with the nutritionists, who don't talk very much with the biodiversity specialists and the conservation biologists. So putting all of the pieces together is also speaking across many languages, many interest groups, and at a worldwide scale. Because, of course, except if you're Walter Willett, we are really not even aware of where our food comes from, of which continent it comes from, and certainly not whether it was produced in a sustainable manner. Now, all of this is not to say it's hopeless. All of this to say that we need a new kind of diplomacy and a new approach to this. And I'm pleased that the United Nations is taking an important step in this direction by hosting in September the first UN Food Systems Summit at the time of the UN General Assembly, General Session. And this UN Food Systems Summit, in its preparatory work, has already engaged in national dialogues in dozens of countries. I think it's fair to say at least 60 countries and probably many more, recognizing the interdependencies of the farmer communities, the biodiversity, the climate challenges, both in terms of the effects of agriculture on climate change and the effects of climate change on agriculture, and the nutritionists and the public health specialists who, like Walter, have just shown how this is an ongoing epidemic that has absolutely exacerbated the COVID pandemic because of the comorbidities involved with COVID-19 and the long-term comorbidities that are related to the dietary problems. So in the end of July 26 to 28, there will be a summit in Rome at the home of the UN agencies, FAO in particular, the Food and Agriculture Organization, also the World Food Program and IFAD, to host leaders from around the world to raise the attention to the September UN Food Systems Summit. Then in September, I think it's fair to say that the core outcome that is hoped for is to impress upon every government the need for a strategy on food systems that is based on healthy foods and that is based on sustainable agriculture as the two pillars. So what we eat and how we grow the foods, because most countries do not have a strategy for this. We were delighted, Walter, yesterday we're in Barbados discussing development issues with the Prime Minister of Barbados, and as we were going to our meeting with her, a big sign on the side of the bus said, "We are drinking too much sugar beverages and we need an approach. We need policies for more healthy diets." We took a picture of it to bring back, but this was on the side of a public bus, making the point that in Barbados, there is a diabetes crisis. In Barbados, it's so sad, but that's because the Coca-Cola and others got here and have created havoc in the diets in this country and around the world. So one of the things that I'm really so thankful to the Culinary Institute of America is the attention to this issue. Also, we need our great chefs and our culinary experts making delectable foods that are healthy for us. And we need the food industry to step up, because I think being the head of, to my mind, head of Coca-Cola or PepsiCo right now is a little bit like being the head of a coal company. You know, they're both doing great damage to the world, and they need to step up with responsibility and to say, we're going to make products that are healthful for people, not just meet the bottom line. And the obesity epidemic needs to be brought under control. You more than anybody, Walter, have shown that it is unhealthy foods and people not knowing the kinds of diets, and poor people, because of the low cost of calories and unhealthy diets, consuming unhealthy foods, that are ending up so vulnerable to no wish of their own. And this is a kind of addictive behavior, many of these highly processed foods that we're grappling with also. So the Culinary Institute, I think, can play a great role here. The food industry really needs to take responsibility and say, we got it. We see that this is a crisis. We need to pay attention to these two basic pillars, that what we produce is healthy to eat and how we produce it is safe for the planet. And thanks goodness you can combine those two. In fact, it seems that there's no other way than to combine the two. I think the final point that I would emphasize, speaking from the climatology point of view, one of the striking findings repeated in several important studies this year in the climate science literature is that we will not succeed in containing the climate crisis without solving the land use crisis. This wasn't to be taken for granted. Most of my time on climate change over the past 20 years has been about the energy system, because the energy system is responsible for 70% or so, maybe 85%, I should say, of the CO2 emissions, and 70% perhaps of total emissions. But what is clear is that with the crisis that we're facing, the major contributions of agriculture and land use change to the climate crisis is now so significant, and our margin of maneuver on energy is now gone, basically. We have to move to decarbonization directly to reach zero, absolutely globally, no later than 2050. We're going to have land use solutions alongside. Otherwise, we won't be able to achieve climate safety, the 1.5 degree Celsius upper limit. So what we're talking about is extraordinarily important. It's complicated. Again, I want to pay tribute to you, Walter. You have done more than anybody to direct the world's awareness to these interconnected crises. The UN is trying very hard, and I'm trying to give all the support I can to bringing this to the forefront now. And I expect that as of September, the message will be loud and clear. Every country needs a strategy for healthy diets and a healthy way, safe way to produce food. And we need all the culinary experts to help us to get there. So just a few brief remarks, and so happy to be on the panel.
Thank you, Jeffrey, and thank you, Walter. Jeffrey, I think the last time you and I met was as undergraduates when we were lamenting the quality of our social life.
There you are, Michael. How are you?
So a quick question for each of you, Walter and Jeffrey. So if you were to plot on a graph over the last, let's say, 20 years, your level of optimism about the kinds of changes that we need to make as a society within the U.S. and across the world, how would that go up and down, and where are you now? Walter, maybe you could kick that off.
Yes, well, a very interesting question. It was definitely on a downturn rather dramatically until January. Then when we had leadership in this country that was very influential across the world, really, first of all, denying that the problem even existed, and then actively trying to promote coal and fossil fuel consumption and stall green energy. I mean, how could one have been going backwards as fast as possible? And then we have had a change in leadership that has, I think, generally recognized the problem and doing more than I expected, actually, to seriously implement policies that would get us where we must be going, as Jeff so emphasized, and getting there quickly. Not that every policy is perfectly on target, but the vast majority are. Now, there's still, of course, massive obstruction to that on the part of invested interest, and just sometimes, disturbingly, for sheer political reasons that don't seem to have any obvious rational basis. But at least there is hope. But it's going to be, in our Eat Lancet report, we could barely get where we need to go if everybody did everything right. And of course, humans are humans, and not everybody's going to do everything right. So I'm still on the edge. I'm more toward maybe a neutral position where there is hope, but it's not a foregone conclusion that just because we have some leadership that wants to do the right thing, that it will happen.
Jeffrey, what are your thoughts?
Yes, things seem to have reached a plummeting grimness in recent years, and as Walter says, there is new hope politically. I would say that it's a very complicated situation, and I would put the following points quickly on this question. First, global awareness is higher than ever. This is really important. There is more awareness that we are in a crisis, and COVID, of course, greatly amplified that sense. Second is the challenge of complexity. Our governments are basically overwhelmed. They're being tasked to do things they don't know how to do. And so we really are in a period where not only who has power, even when people of very good will are in power, the complexity of the agenda is really quite high right now. So we need to sort out some basic guideposts of things that need to be done. For example, reaching net zero emissions by 2050 is one of those understandable, crucial, and in a way extraordinarily helpful guideposts, because it gives us a direction. We need the same with regard to diet, and we need the same with regard to protecting biodiversity. It's hard, but that is crucial for overcoming complexity. The third is we need cooperation globally, and this is it's absolutely a freeway here. Sonia, thank you. So right now we're enmeshed in one geopolitical crisis after another, and this is impossible. We can't be fighting China and saving the planet at the same time. We need to be cooperating with China. We need to be cooperating with Europe. We need to put aside the local bickering in so many places in the world, because we've reached an urgency on the issues that we're talking about. So can all of this be done systematically, quantitatively, logically? Yes. Walter produced a pathway for safe diets, healthful diets, and a safe planet in the Eat Lancet Commission. I've been leading projects for a number of years showing that we have a pathway to reach net zero emissions of greenhouse gases by 2050. It all practically can be done. We need to do our part to help the design to say this is feasible, not just to wait for our government to do it, because they're a little bit overwhelmed in this, and also to raise our voices that we need to cooperate right now, put old games aside so that we can actually solve these problems. By the way, one last point I'll make. The rich need to share with the poor for this to work. Mr. Bezos reached $201 billion yesterday in his bank account. We know from ProPublica, he did that with paying almost no taxes along the way. We're not going to make it unless we understand that even Mr. Bezos is on this planet. He wants to go to Mars. He wants to go to the moon, but he's a member of Earth, and all his customers are, and he's going to have to contribute more. He did put in $10 billion into a new foundation for climate change. That's a good start. Taxes would be another wonderful contribution. And we've got to get on to a world in which we recognize our common fate. And then, Michael, that's the long-winded way to say we can still do this and we can better it.
Well, thank you, Jeffrey, and thank you, Walter. And sadly, we've come to the end of our time. We've had some great questions posed by the audience, and perhaps later we might be able to address those. But right now, thank you both. Enjoy your time in Barbados, Jeffrey, and Jacqueline, back to you.
Thank you so much, Michael. And thank you again to Walter and Jeffrey for joining us. I think we clearly hear the message that we need larger leadership, or leadership at the very top levels, but that also we need leadership down here in our practice, in our industry, to make that change happen at the highest levels as well. A reminder that all of the presentations, recipes, and recordings of all of the sessions during the summit, including this last conversation, are available to you on the summit materials page of our website, and the password was emailed to you earlier this week, and can be found by scrolling down below the stage video as well. And now we are headed into our first Sustainability Innovation Hub and Networking Time, sponsored by North Harvest Bean Growers Association. We hope you had time to try their snack inspiration, the multi-grain bruschetta with white bean spread and Swiss chard. And while it's rewarding in itself to make new connections, participating in the following activities will also give you the opportunity to win some great prizes, including free conference registration and travel to next year's summit in Hyde Park. Jump over to the networking tab to start a one-on-one chat with another attendee. Today's conversation prompt is, what is your primary sustainability priority for 2021? And you can also hop over to the Meet the Author booth featuring Walter Willett to purchase his books, as well as to interact directly with him if perhaps you've got a lingering question. I know there are lots of questions going on in the chat that unfortunately we didn't have time to get to, so head over there to chat with him. We've got special culinary demonstrations happening in the Sessions tab. And throughout these various activities, we hope you'll hit that share audio and video button to join the screen and ask your questions and interact live with our presenters and other attendees. Don't miss out on the awesome activities happening in our Sustainability Innovation Hub, thanks to our generous sponsors, which is also where you can find them to thank them for supporting this program, as I mentioned earlier. You can see from today's themes and activities that there is a lot going on in their booths, and the activities will change throughout the summit, so be sure to visit often. So enjoy this first networking time sponsored by the North Harvest Bean Growers Association, and then you won't want to miss our next general session, where we'll hear highlights from the 2021 Data Essential Plant Forward Opportunity Report. See you all back at the stage at 11:15 a.m. Pacific at 2:15 p.m. Eastern.